Okay, let's go ahead and get started, Jane.
Welcome, everyone. This is our 13th webinar over the past 2 months of Horizons webinars that we've been doing. And we have two really special guests from the Faculty of Nursing for this webinar to give you some more information about the program of nursing. We'll be debunking some myths and answer any questions that you may have about the program. So as Nagar has been mentioning, please keep your video and your microphone off throughout the webinar, and there will be a Q&A at the end. So be sure to send any questions that you may have to Nagar using the chat function. The Haudenosaunee Nations, and within the lands protected by the Dish with One Spoon Wampum Agreement. This agreement is also a covenant with nature. Take what you need, leave something in the dish for others, and keep the dish clean. We share this acknowledgement with you today to urge everyone to reflect on who originally protected and cared for this land, how we came to be here, and the original responsibilities we hold in caring for the land with the, especially in institutions, to create a space where we can engage in conversations about the reality of Canadian history, challenge our dominant ideologies, and continue to call out injustices and inequalities that impede us from Indigenous justice and reconciliation. So we encourage everyone to take the time to learn and reflect on the history of the land that we live on. So we've provided a link, www.whosland.en. So you can go to that link and you can learn more about the land that you live on there. So to start off, we'll talk about what the McMaster Student Union is. So I'll pass over the mic to Nagar, our Horizons Conference Coordinator.
Okay, awesome. So I'll just quickly be chatting about the McMaster Student Union, also known as the MSU. So the MSU is a student organization that represents over 24,000 students. It's comprised of all undergraduate students enrolled in 18 units or more. They run over 36 business units and services to help enhance student life. So business units are usually on campus, but services are ones that are on campus but will function also online and virtually in the fall. There are services that are catered specifically to first years and ones that you can get involved in later on throughout your undergrad. So Horizons is a service that is governed by the MSU, and Jane will explain a little bit more about what Horizons usually is and what we have adapted it to this year.
So every summer, Horizons offers a 3-day, 2-night leadership conference that happens on campus, where we have incoming students join us and upper year volunteers come on campus for this conference. And it's full of different leadership activities and events that will provide you with a foundation for leadership and academic excellence. Unfortunately, this summer, we were unable to have the in-person conference due to COVID-19. So instead, what we've been doing is offering online programming through virtual webinars like this one, and also Instagram. We've been offering sessions, which are a key component to our conference, where you're able to engage in different activities where you'll be learning skills that will help you not only through your undergraduate experience, but also throughout your life. So that's how conference has changed, but hopefully next summer we'll be back to the in-person conference. So another welcome slide. So as I mentioned before, this is part of a weekly series. So each week we have a different topic with new guest speakers, and today this is the nursing edition. We will be answering some of the questions that you guys have been sending us on our Instagram at MSU_Horizons. If you're not following us, you should. And if you have any questions that have not been addressed throughout the webinar, you can send them over to Nagar through the chat function, and we'll try our best to answer them. So just to introduce our team. So my name is Jane, and my pronouns are she and her. I'm going into my final year of health sciences, and I'm the Horizons Volunteer Logistics Coordinator, and I'll be moderating today's session.
Hi everyone, my name is Nagar. My pronouns are she, her. I am going into my 4th year of chemical biology co-op, and I'm the conference coordinator for Horizons this year, and I will also be the moderator. So if you have any questions, feel free to send them using the chat function my way, and we will get to them in the Q&A period.
Hi everyone, my name is Ganeet. My pronouns are she and her. I'm going into my 4th year of health sciences. I'm one of the events coordinators for Horizons, and I will be administrating this webinar. So if you have any technical difficulties, please message them over to me.
Hi everyone, my name is Gari, my pronouns are she and her, and I'm also going into my 4th year of health sciences. I'm one half of the sessions coordinators for Horizons, and like Ganeet, I will be an administrator for this webinar, so if you do have any logistical issues, you can either message me or Ganeet.
Awesome. So now to introduce our panel, so I'll pass over the mic to you.
All right, hi everyone. My name is Maxine. My pronouns are she, her. I am in the nursing program. I'm in the basic McMaster stream, and I'm going into my 3rd year this year. I am also the 2020 Nursing Welcome Week planner for this year. So if you have any questions about Welcome Week for nursing, just ask me. Some of my hobbies include making bread. I've been making a lot of sourdough during quarantine. I'm currently working night shifts as a PSW as well, which is something that you can do after your first year as a nursing student. And I've been binge watching a lot of shows on Netflix. If you have any questions after this webinar, you can message me on Instagram or send me an email. You can also send an email or message any of the McMaster Nursing Welcome Week pages, which will all be at the end.
Hi, my name is Jennifer Fan. My pronouns are she, her. Like Maxine, I'm in the basic Max stream of nursing. I'm in my 3rd year. I'm the 2020 Nursing Welcome Week social media coordinator. So if someone's messaging back on like the Mac Nursing WW Instagram, it's probably me. My hobbies include crocheting, painting, and eating good food, as you should.
Awesome. Thank you to Jennifer and Maxine for joining us today. I'm sure this will be a very informative webinar. So we'll start off with an overview of the School of Nursing. So I'll hand it off to you.
All right. So we think that like nursing is pretty self-explanatory as a faculty and as a program. The overall vision of the faculty is advancing health and well-being through excellence in nursing. As you probably know, nursing is a 3-site, 3-stream program. So there's 3 sites in total. There's McMaster, Mohawk, and Conestoga. McMaster and Mohawk both have classes and placements in the general Hamilton area and on McMaster campus. And then Conestoga is in Kitchener-Waterloo, and all the placements are in Kitchener-Waterloo as well. It's also a 3-stream program. So there's the basic stream, which is the 4-year direct entry school program. There's also the RPN to BSCN program for those who did practical nursing first and are now transitioning to the RN program. And then finally, there's the accelerated stream, which is for those who have completed undergraduates in science degrees and then are now looking to get their RN license. No matter what stream or site you're in, everybody graduates with a Bachelor of Science in Nursing degree from McMaster University. It doesn't matter which site or stream you're in, everybody gets the same degree at the end of the day.
So I have a question. So you mentioned that you all get the same degree, but is there a difference in the type of placements that you might be in, or like the core foundation of the education you would get if you were at the McMaster stream versus COMAC versus MOMAC?
No, everything is same across the board, no matter what you are. The only difference is location.
Okay, perfect. So we'll move on to academic tips. So I think this will be really helpful for folks who are going into 1st year to learn about how to study, especially in nursing.
So for the academic tips, number 1 is to stay caught up on your assigned readings. So in your classes, especially in PBL, you're going to have a lot of readings to do for each week. And it's really important in PBL because it's a discussion-based class. You're going to be in groups. You guys are going to be discussing topics or like a scenario. And it's really important that you have done the readings because they're mostly going to be discussing things about the readings. So it's just good to stay caught up with those and actually do them.
No, I'm going to go in the other room.
2, attending peer tutor sessions. So during the year, on weekdays from Monday to Thursday, there will be peer tutors in the CSBL lab. So that's the lab that you have your clinical lab in. It's in the Health Science Center. It's basically just a facility that's meant to like emulate a hospital. So there's going to be a bunch of rooms. There's going to be hospital beds, a bunch of equipment like blood pressure cuffs. It's basically just like your fake hospital setting. So throughout the week, they'll post it on their little Facebook. There'll be peer tutors, and they're there to help you with anything. So you can go and you can practice assessments on them. You can ask them questions about your classes. If you need help with like homework or anything, they're just there to help you guys. Number 3 is to have good communication in group projects. So especially in nursing, in almost all of your classes, you're going to have group projects or you're going to have to be in groups. And it's good to have good communication with them. They usually recommend that you have Facebook groups or like iMessage group chats just so you guys can stay in touch, and make sure at the end of each class that you say like, oh, I'm doing this, what are you doing? So everyone's on the same page. It's also important to read the syllabus and keep track of due dates. This is something that me and Maxine both really needed to work on in first year. So your syllabus is another word for a course outline. All your classes will have them posted on Avenue under content. Usually it's like the first thing posted. It looks long, but you guys should really read it because it has all the due dates in it. It has basically what your course entails, like how much your exam is weighted, how much your midterms are weighted. And it's really important that you contain those due dates in your head, put them on your calendar, put them somewhere, because it's really easy to miss them or like forget with everything going on. And then number 5 is to do practice assessments on your friends or family where it's safe. In your clinical lab, you're going to be learning a lot of assessments. You're going to be learning how to do health histories, do interviews, do like cardiac assessments, all of that. And it's important that you practice them so when you get tested on them in clinical, that you know what you're doing and you'll feel more confident about it.
Awesome, all really great tips. I just wanted to highlight the Center for Simulation-Based Learning, the CSBL that you talked about, something that's really unique to the Faculty of Health Sciences, including the Faculty of Nursing. I was wondering if you could talk a little bit more about something that you would do in a typical class, an example, something that you've experienced.
Okay, so that's going to be your nursing IO2, JO2 class. That's where the labs on your schedule will be held. So basically, you're going to be in a small group and you're going to have a clinical tutor who's leading you guys. It's basically a typical day. You have to wear your scrubs in the lab because during your assessments, they mark you on professionalism. You should have your hair tied back, or you should have your nursing badge, everything like that. And so each week, basically, they're going to teach an assessment, or you're just going to go over some stuff. So for example, if it's like a cardiac systems review day, then like they'll have someone be the little patient, and then you can use your set skills and practice on them. Basically, you're just there to learn the skills that will help you in second year in your placements and third year and everything like that.
That's really good to hear that you have a lot of hands-on experience, especially from first year. It can really help when you go into your placements for sure. So it's great to hear. Maxine, if you want to add anything about CSBL and your experience.
I think Jen pretty much covered everything. It's basically where you have the chance to practice all your assessments. It's usually on like your peers. They also often hire actors to come in. It's also how all your assessments are done. You're going to be doing all your assessments. Basically, it's going to be you doing some sort of skill on an actor, and that's how you're evaluated. That's where you get the chance to practice all your skills. If you want extra time in the lab, you can usually book extra time online. That's where, as Jen said, peer tutors is so important, especially for nursing. If you're feeling confused about any of the skills that you learned in lab, go to peer tutors. And they will go through like each of the assessments like step by step with you. And they also often have Elaine, which is she's in charge of CSBL as like a whole and all kind of first year clinical is like her responsibility, and she'll often be there in the evenings to help you with any of your assessments.
Awesome. It sounds like there's a lot of support in terms of academics, which is great. So now moving on to kind of the other side of school, which is getting involved in extracurriculars and volunteering. So I'd love to hear more about that.
So nursing as a faculty doesn't really have very many clubs. I would say that's probably the one area that our faculty is probably lacking the most. I think it's because most people are very busy with clinical, so they tend not to get very much involved in extracurriculars, especially once you get to fourth year where you're basically working full time. But the two big clubs that we do have in nursing is MUNS and then Goonies. So MUNS is our student society. It stands for McMaster University Nursing Student Society. And these are all our student representatives. They all come from different sites and streams. So for example, for the level 1 representatives, which elections are going to be in around September or August, if you want to apply to be the level 1 MUNS rep, there's going to be 2 positions for each site. So 2 McMaster level 1 reps, 2 Mohawk level 1 reps, and 2 Conestoga level 1 reps. MUNS meets every other week. You're going to meet at either on McMaster campus or the Conestoga campus. This year meetings will most likely be online. And the responsibility of MUNS is basically what they do mostly is advocate for nursing students within the nursing faculty. So if there are things that you want changed within the curriculum, if you want like a certain program to be put in place, that all goes through MUNS. They're also the ones that run all the fun events throughout the year. So things like coffee houses, nursing formal, that's all run through MUNS. And the last thing that MUNS does is education sessions. So they've done a bunch over the years. They've had different nursing speakers come in. Last year, they even had a phlebotomy course, which was really cool for those who were able to sign up. Sadly, I wasn't able to make it, but I'm crossing fingers that they'll be running it again. They've also run like ECG reading courses in the past, things like that. That's all through MUNS. So if you want to get involved in that, I highly recommend it. Go follow MUNS on Facebook and Instagram and message them. They always have someone that's like ready to answer, which is usually Jen, because she runs the social media pages for MUNS. The next big club in nursing is Goonies, which is Global Understanding Through Nursing Initiatives. So for those of you that have interest in doing international placements in fourth year, because it is an option, that is what that club focuses on. So if you want to do a placement within like rural areas in Canada, so like Northern Canada or out east, or if you want to do placements in South America or Africa, any type of global placement, usually you do have to join Goonies, at least I think second or third year. And then Goonies will also give you a better understanding how to go through the application process of doing an international placement. They also have students who did do international placements come and speak on their experience. And then they also just focus on like global nursing initiatives in general. So if you have an interest in that, I would highly recommend joining Goonies. And then the last way to get involved within the nursing faculty is just social events. Join all the MUNS events when they do nursing formal, when they run courses, coffee houses, things like that. They're always so much fun, and they're great ways to get to know more people within the faculty and different people from different sites and different streams, especially if you're from Conestoga and you don't know people from McMaster or Mohawk or vice versa. It's a great way to get to know more people. If you want to know more about either one of MUNS or Goonies, during Welcome Week, we're going to have individual events for both. Goonies is going to be running a webinar where they're going to invite a student who did an international placement to talk about it, and so that you can ask questions. And MUNS is going to be doing a session as well during Welcome Week to ask. So if you have any questions about that, that's where you can find more information.
Awesome. I actually had a question for Jennifer for this slide. So I know you're involved in MUNS, and my question was about the academic sessions that you offer. I know other programs will have their societies that do like chemistry 1A03 prep session or anatomy prep sessions. Do you guys run those?
Oh, yes, we also run those as well. Usually they'll be run by the level 1 representatives or whatever level you're in. And they'll be posted on the MUN's Facebook page or Instagram pages. So make sure you guys follow those for updates throughout the year. Historically, they've done stuff by request. So a lot of people requested like an anatomy study session. It's basically like they get the prof and then the prof would go over questions, basically do a review. And I've gone to some of them and they're really helpful. Especially if you're like cramming all that studying in during exams. I'd highly recommend going to them. So yeah, make sure you follow the Instagram and the Facebook to keep updated.
Awesome, that's great to hear. In addition to the nursing specific clubs that you can join, there's also tons of clubs at McMaster that you can join to meet people who are outside of your faculty. It's a really great way to meet new people and expand your perspective on things as well. We have over 350 clubs at McMaster, and that number is always growing because new clubs are always popping up. So I'm sure you'll find something that you're interested in. We'll have one of our team members link to all of the McMaster clubs if you guys are curious and seeing what else is out there. So that's great that there's lots of opportunities to get involved with the nursing as well. So we'll move on to some myth busters. So I know lots of programs have myths that are associated with them that we used to think before we came into first year and learned that they weren't true. So I'd love to hear some of the myths that you guys have learned are not true within nursing.
Okay, so these are just some that we've collected that like we thought of what we heard in the rumor mill. So the first one is that first year clinical is all wound care. This is false. You learn wound care in second year lab. First year clinical is mostly you learn your health history, you learn how to interview patients, and then reviewing the system. So you learn how to assess the MSK system, your cardiac, respiratory, stuff like that. For the second mythbuster, we have professors/instructors are intimidating. Well, that might be true that they maybe look scary, but they're actually there to help you guys. So if you have any questions or you don't understand content, like feel free to email them, message them, talk to them after class. They should have office hours too that they'll post on Avenue in their little course shell. It should be like a little announcement. That will probably be Zoom calls, but they're the profs and the instructors, they're there to help you. Don't be scared to ask them questions or anything. And they're just like readily available. They're willing to help you. Number 3, with so many people in nursing, it's going to be hard to find friends. I found that with nursing, since mostly all of you guys will have the same classes together for almost throughout your whole degree, you're going to have a lot of familiar faces, and then in most of your classes you're going to have a lot of group projects, so there's like a lot of opportunities to meet people. Basically you'll be familiar with so many people, and it won't be that hard to find friends.
Yeah, these are definitely common myths that not only are relevant for nursing, but I also feel like, especially the professors and instructors are intimidating. I also thought that coming into first year, but all of my experiences with profs and TAs are exactly what you said, Jennifer. Like they're just here to help you and they want to see you succeed, which is really nice knowing that going into your courses. That's great to hear. Maxine, did you want to add anything else to this slide?
Yeah, like Jen said, like nursing is a very like group work focused program. Every single class is collaborative no matter what. Especially clinical, you'll find that a lot of people, because you're in small groups of about only 8 students and if you're working with a tutor, a lot of people develop very close relationships with their tutor. I developed a very close relationship with my level 1 as well as my level 2 tutors. They were very good friends of mine. They gave me so much advice, both academically and personally. It's the same thing with your PBL tutors. Because you're in a small class setting, you get to know them very well. And oftentimes, like even at the end of the year, you'll be like, oftentimes you do like end of year parties with them and things like that. Oftentimes clinical tutors will even take you out for dinner at the end of the year as kind of a celebration. So definitely don't be intimidated by them. Don't be afraid to ask them questions. Don't be afraid to send them emails. A lot of them will even give you their personal phone numbers. So it is a very tight-knit program. Don't be afraid to reach out to people. And I think nursing is very common to other faculties, other science faculties. Especially we're doing science courses. We share anatomy class with health sci. Like it's there's a lot of classes that are very similar to university experience. The only thing is clinical, and that's the one that Jen covered, where people think that first year clinicals, you're coming in, you're learning how to do trauma, you're learning how to do CPR, but it's very much not the case, and it kind of shocks people at first. But what first year clinical is like really focused on is building up your communication and assessment skills so that when you go into the hospital setting, you're kind of prepared for any situation, to evaluate any situation and know where you have to go from there.
I just had a quick question. I was just wondering, since you talked a lot about the peer tutors, how can and where can students connect with their peer tutors, and like when will they be connected to them?
So typically peer tutors is available from Monday to Thursday from 4 to 6 p.m. at CSBL or wherever you have your clinical lab. So for Mohawk, it's in the IAHS building, and for Conestoga, it's in the health science section of Conestoga in their lab as well. They have not announced how they're going to do peer tutors this year. They're still running it, but it's most likely going to be accessible online. There is a peer tutors Facebook page. If you go into, there's a McMaster like nursing student success guide that's being sent out that says instructions for how to find your peer tutors for each site. So go through that. But for this year specifically, they haven't announced yet how specifically they're going to do it.
Cool. So they should just keep an eye out for emails or any instructions that will be sent their way, right?
Yeah. Yeah. And then if anything, ask your clinical tutor, or I'll find the email for my master site. It's Elaine. She's the head coordinator for peer tutors. But other than that, ask either your clinical tutor or your PBL tutor. They should know for your site.
Perfect. Thank you.
Okay, so I think we can move on to some frequently asked questions, because there's some questions that we get really often. So the first one is, what is an OSCE?
So this is probably the question that we get, like the one thing that we get like the most questions about is the OSCE. This is how you're evaluated on your clinical skills first year. And it's basically like the only like really big assessment that you have for clinical. You do have some quizzes throughout the semester, but this is the big one. It's basically like a mock kind of patient scenario. So what's going to happen is that you're going to go into the room, and there's going to be a tutor sitting in the room, and there's going to be an actor that's pretending to be a patient sitting on the bed, and you basically have to go in and talk to the actor and figure out basically which assessment you should do and then conduct that assessment. So for example, second semester, you focus on bodily systems. So you would go in to the assessment and you would ask your patient, oh, okay, well, like what brings you in today? And let's say, for example, they say, oh, I have a bad cough. So then you would ask further questions to know whether or not you need to do a cardiac or a respiratory assessment. And then afterwards, you would do the assessment that you think is the most appropriate, and then you get graded based on that.
So I think that was a pretty good overview of what that is. And is this something that you do at the end of each year, or is it just a course for first year?
The OSCE is the assessment tool that they use for clinical. So you do one at midterm, and then you do one at the final, and you do it both semesters.
Okay, awesome. So moving on to the next question, which is, what should I buy for first year? How do I take an online class is the next question.
So for the online classes, there's going to be two types of classes. There's the virtual classroom, and then there's an online classroom. So a virtual classroom is where the instructors lead a live lecture. So usually that will be on Zoom or WebEx, which is another program where you can attend lectures. And it will take place on the time slot that's in your schedule. So say if you have PBL on a certain time on like a Monday, then that's the time that the class will be led at. They probably won't post these on Avenue, like they won't post any recordings, so you're gonna have to attend it live. And you're gonna have discussions and stuff like that, similar to like an in-person lecture. For an online classroom, that's gonna be modules and videos and stuff that they post. There's no set time for these. You can watch these modules or videos whenever you'd like. There's also going to be quizzes and stuff. Those might have deadlines or times on them, little time slots where you'd have to complete them. So classes like for your clinical lecture, those are going to be pre-recorded videos or modules that you have to watch. You can choose to watch them before your lab, which is in person, or after, whatever works best for you. It doesn't really matter what time that you watch them, unless it's like before an exam. And as I said, like there's no scheduled time or date, so it might have like a time slot on your schedule, but you can choose to ignore that if you'd like. And yeah, so most of your classes will be on the virtual classroom, like PBL, and everything else will probably be an online classroom.
I know some of these words can be confusing when you're seeing them on your schedules for the first time, especially because everyone's moving over to this virtual side of things for the first time. So thank you for giving that distinction. So now the next question is actually, what should I buy for first year? I know when you're reading your course syllabuses and there's so many things that are listed of required textbooks to buy and things like that, it can be kind of overwhelming. So I'd love to hear from two experienced nursing students on what you actually need to buy for your first year.
So basically, besides what's listed in the course syllabus for all your courses, the big thing that you need to buy is your level 1 clinical kit, which is going to be sold on the Pristine Medical website. If you get once you get your success guide, the link is in the success guide. It will also be posted on Avenue under your clinical class, but just make sure that you buy that because that has everything that you need for clinical. And then your lab coat, if anatomy, typically you need your lab coat for anatomy labs. They won't yet let you in the lab if you don't have one. However, anatomy labs are not being run, from what I know, first semester. They might be being run second semester though, depending on how things go. And in that case, you will need the lab coat. And then the last thing you need,
I can pick up for Maxine. So the last thing that you need are the BSCN crested scrubs. They specifically say on the logo, McMaster Nursing BSCN program. So like you'll know which ones to get. They're the same scrubs for all 3 sites and all 3 streams. And then in the level 1 clinical kit, as you can see, there's a blood pressure cuff, a stethoscope, and then they have PPE. Just a disclaimer, this does not mean that when you show up to clinical, you have to wear a gown and a mask every time. Those are when you learn how to don and doff your PPE. So that means when like taking off your personal protective equipment and putting it back on in the correct sequence so that you don't contaminate anything. That will be one of the things that you learn. And so you'll need those to show up to class. Your clinical tutor will let you know like, oh, for this day, I want you guys to bring your gown and your gloves and your face shield and stuff like that. So that's when you use those.
So typically you would buy these like equipment from the health sciences store, but since students can't go onto campus, do you know if they can purchase them online?
Yes, so as Maxine said, your student success guide is basically like a big PDF where they put all these resources on that I'm not sure if you'll get emailed that, but on there's a link to the website that sells this clinical kit. It's called Pristine Medical, and they actually do delivery, so they can deliver it to your house or your residence. For the stethoscope, actually, sorry, this doesn't have to do with shipping or anything, but make sure you get the Classic 3, because any of the other ones, say like it's the Light or the Classic 2, They won't be able to pick up the deeper sounds when you do assessments, and you don't need any fancy ones like the pediatric or the cardiac ones. The Littman Classic 3 is the standard.
Awesome. So we went over, Maxine, since you're back, we went over what you should buy for first year. If there's anything else you wanted to add to the slide before we move on to questions.
Oh, sorry about that. My laptop just crashed. I had to restart it. But thank you, Jen, for carrying on. Other than what you really need for clinical, that's probably the most important thing. Other than that, just follow the syllabus. Basically, the big textbooks that you need are the ones for PBL and clinical. Those ones you have to buy no matter what. Do not skip out on buying those. However, the other courses, it really depends on whether or not you kind of really want them, or if you really think that you need them. If you're someone who really benefits from having a textbook, get them. Other than that, they're not like 100% necessary. Most of all the material is from the slides and from the lectures. Yeah.
It's also great to hear because there's usually lots of textbooks that are listed, and usually it's like recommended readings, but not super essential, so that's good to know. We'll move on to our Q&A session. So any of the questions that you've been sending to Nagar, she'll read some of them out and we'll get them answered for you.
Okay, awesome. So I've been getting a few questions. So we'll start with something that I think a lot of people are asking about is what is the process like to get a placement, and how difficult is it to be placed?
So basically the process for second and third year placements is completely random. You don't get a say in what type of placement you get. And that's just because there are limited places that they can get placed. And a lot of times people want the same placements and they just can't do that. There's a limited number of spots. Usually there's 2 clinical days, and in each clinical group there's 8 people and there's only 1 group per floor. So as you can imagine, only 16 people can get that 1 floor for the whole semester, so they assign them randomly. How clinical does work though is second year, you start off with very general placements. So you get 1 general surgical placement and then you get 1 general medical placement. So for example, my first semester, I was placed on the orthopedics, surgical orthopedics floor at Juravinsky Hospital. So that focused mostly on knee and hip surgeries. And then for my second semester, I was placed on the CTU West at St. Joseph's Hospital, which is a clinical teaching unit, which is basically a general medicine floor. So you have patients that have everything from sepsis to multi-organ failure. It's all very kind of general. And then your third year is when you start to get more atypical placements. So atypicals are things that are considered more high risk. So things like mental health or pediatrics or maternity, those are all third year placement options. However, you will only get one of the 3. So you will get mental health or pediatrics or maternity. And then your other one will be a more high risk floor. So for example, you'll get mental health and cardiac unit, or you could get pediatrics and like a step down neuro ICU. So like a step down ICU, so patients who just leave the ICU, step down from that. And then where you do kind of get a say in your placements is for your 4th year consolidation placements. As long as you qualify for atypicals, I believe you need to have at least I believe it's an 8.0 GPA on the McMaster 12.0 scale. And you need to have at least 2 letters of recommendation from your tutors. And then that way you can qualify for atypicals. So that means placements like ICU, ER, NICU, which is the neonatal ICU. And 4th year, you have, as long as you qualify, you'll be able to rank your placements. However, there's still no guarantee that you'll get them.
Okay, perfect. Jennifer, do you have anything you want to add to this?
I'm not sure if they're running KO2. Are they running KO2, Maxine?
I believe they've put off KO2. KO2 is the community placement that you typically have first year. I believe for first semester, they're not running it. They may or may not run it online, but from what I know, they're not running it yet.
Okay, so that's basically at least in like past years, that's basically your community placement. So you're going to be, it's like the same sort of website called HSPNet where you can decide your top 5 placements. And usually it's stuff like nursing homes or like other volunteering positions. And that would be what your placement in first year would have been.
Yeah. So you could do
Got-
things like volunteer at a nursing home. I had mine at, oh my God, I can't, the YWCA Good Beginnings program, which is basically you get paired up with a mom with a newborn baby and you help them take care of the baby. There are people who got placed at elementary schools for like Best Buddies programs, things like that. So yeah.
Okay, awesome. So the next question is, sorry, my voice. So if I want to work during the nursing program, how many hours do you think is manageable? So I think got this question a couple times, just like how you think the workload is manageable with maybe a part-time job. If you have any experiences or any thoughts on that.
So I actually worked part-time at Williams across on Main Street during the school year. I did about like 2-3 shifts a week, and I found that it was pretty manageable. It was like at least 10 hours a week. It wasn't that bad. If you do decide to get a job, I would definitely talk to your employer and say like, here's the thing, like I don't want to work that many hours, or if I can only get like X amount of shifts, 2 or 3 is fine. Even once a week is fine. And then make sure that you know when all your midterms or if you have exams, make sure you let your manager, your employer know, hi, I can't be available for these days. So then you have time to study and actually do your exams.
Cool. Maxine, do you have anything to add to that?
Yeah, like Jen, I worked too. I worked as a server in Westdale, and I worked about like 9 to 12 hours a week. It's pretty manageable. I also worked at a different restaurant in Hamilton as well my first year. A lot of the employers around the university are pretty understandable about school hours because they know it's a university town and they know almost everybody is a university student. So they're pretty understanding. If you want to get a job with like the MSU or on campus, they're even more understanding from what I hear. Like one of my friends worked at the restaurant on campus and they were extremely understanding. In fact, they were even closed during the holidays and reading week. So she didn't even have to worry about booking time off. In terms of jobs as nursing students, a lot of students during the summer get jobs as PSWs just because it's a good way to build up some of your clinical skills, things like bed bath, brief changes, even just interacting with patients one-on-one. It helps a lot. And it's pretty good pay for PSW jobs.
Okay, awesome. Yeah, I think it can definitely seem overwhelming coming into first year and wanting to also like being in a program and then wanting to also do a job can be sometimes overwhelming. But I think if you try to manage your time and just like know where your priorities stand, you should be fine. So I think the next kind of set of questions are all about MUNs. So the first question we have is, are accelerated stream nursing students allowed to apply to become a level 1 rep for MUNs?
Accelerated has their own position on MUNs, and so does RPN to BSCN for each site. And that's just because accelerated students have different needs. They have slightly different curriculum than level 1 students, and so they have their own representative seats.
Cool. And just like to build off of that, do you know what the responsibilities of like a level 1 MUNs representative is and like how you can apply or like around what time you apply for that?
Usually they send out on the MUNs page, they'll post when seats are open and how to apply. And typically, in order to just apply for the position, you need your name, your student number, and then I believe you need like 4 or 5 like people to nominate you. So that basically just means you need their name and student number. It's pretty easy to find. You just ask your PBL group to sign it and they'll all sign it for you. And then if there's somebody running against you, then you'll have to go through an election. If not, then you just get the seat automatically. It does happen sometimes. And then the responsibilities, mostly you're there to represent that section of the nursing faculty on MUNS and express their concerns. So if any students within your level or stream have any concerns that they'd like to be brought to the faculty, they're supposed to go to you. You're also responsible for running academic sessions for your level, site, and stream. So for example, planning those anatomy study nights, things like that. They're all like responsibilities of your level rep. And then there's also usually different events that different level reps run every single year. Like some of them run like coffee houses every year. They'll run like a movie night every year, things like that.
Okay, awesome. That sounds like a great way to get involved. So I'm just going to do one last question. So do you have any studying tips for the human anatomy and physiology courses? So just like overall tips or tricks that maybe you've used in your first year or you've learned throughout.
So as you guys may or may not know, anatomy is like a lot of content that you have to like jam into your head. I've like found that testing your friends on stuff really helps. Some people benefit from drawing it out, labeling diagrams. Some people have like these coloring books. It's like, oh, learning anatomy, and then you like learn the names as you color them in. You can do flashcards, stuff like that. You can also go online and just find like general quizzes. Those will help you with like retrieval practice. Yeah, a lot of it is like you just have to take the time to learn the content, memorize it as best you can. That course is like heavy in memorizing. And if there's like concepts that you don't understand, like say it's talking about the brain and the pathways, you can always go to the office hours for your professor that they might post. There's a bunch of quizzes. Sometimes they post practice quizzes on Avenue as well. It's also like under the tab that says quizzes. You can do those. They're unlimited. They don't count for any marks. Those are also really helpful too.
Like Jen said, office hours, especially for anatomy, if you're lost, Dr. Helly is very helpful. He's known for doing really good office hours. He'll walk you through everything. He's also known for pretty much giving away tutorial answers if you go to his office hours. He's one of those people that will just straight up give you the answers. For anatomy, basically my favorite way to study it is oftentimes if you go on Quizlet and you search the course code, so like you put anatomy 1H06, you'll find a bunch of Quizlets that people have already made. It saves you a bunch of time not having to make them. And then you can just like sit down and go through all of them with like your friends, and just like talking about it and going through the questions helps a lot. So usually like my friends and I, what we'll do is we'll just pull out our laptop or we'll cast it on the TV, and we'll just get a bunch of snacks and we'll spend like the entire night just going through Quizlet flashcards together. And so like we'll cast the question on the TV, everybody will say what they think their answer is, and then we'll kind of go through it. And if we're lost about anything, we'll go through each other's notes and you learn off one another. And that's what I find is the best way to learn, for me at least.
Awesome. So I was just gonna reiterate one point, like office hours. I know that like with things being online, it can be a little stressful. I think even more to go to office hours now. But you can always email your profs to set up a one-on-one if you think that's gonna be less overwhelming. But they're definitely there to help you and help you transition in also this virtual setting. So make sure that you use them as a resource. But that sadly brings us to the end of the Q&A. If we didn't get to your questions, our info will be up on the next slide or the next two slides, and you can take a screenshot and reach out if you have any questions. But I'll pass it over to Jane now.
So thank you everyone for joining us today, especially a huge thank you to our speakers, Jennifer and Maxine, for joining us. Be sure to follow us at MSU_Horizons on Instagram to stay updated. We'll also be posting a recording of this webinar and also the slides to the webinar if you missed something and want to go back, especially what should I buy for first year. I think going back to look at that would be really helpful. So that will be in the link in our bio on Instagram, so be sure to follow us. On the next slide, we have all of our contact information. So in case you want to ask questions, be sure to follow us on Instagram, and you can send us emails to ask questions as well. So that brings us to the end of our webinar. So have a good day, everyone. It's a beautiful Saturday today, at least where I am. So I hope you all enjoy it, and thank you to our speakers again. Bye.